Do you want to know how you can get rid of your pain with intercourse, or maybe even your issues having orgasm or decreased libido? I'm going to tell you all about that and why it happens. I'm Dr. Brenda Heineke with Revitalized Physical Therapy, and let's jump in. So a lot of women complain of issues with intercourse, such as pain, dryness, and then even issues with orgasm. So it's really common. It's not normal though, and that's one of the most frustrating things, is that women are told there's nothing you can do, it's all in your head, or maybe you need another glass of wine, or you need to relax a little bit more. Please don't believe any of that, because that's not true, and even though so many women suffer, it's not normal, and there's things you can do for it. So the reason that women have pain, just to kind of go over the anatomy a little bit first so you can understand. So if you look at the pelvis here, the two pelvic bones, this is the pubic bone in the front, sacrum on the back, and the tailbone down here. Everything inside of this, all of this red, that's all pelvic floor muscle. So it creates the entire floor of the pelvis. It connects to all of the different bones inside of there, and you have different layers. So if you're looking from bottom up, this is the most superficial layer of pelvic floor. So you have vagina here, anus here, and you have this triangle shaped muscle, that's pelvic floor muscle, that's layer one. You also have these sphincter muscles that go around the vagina, around the anus. So they're kind of like a circle, and they basically squeeze that tube shut. So it's very common with childbirth to have tearing in this area. So if you've had any kind of perineal tearing or an episiotomy, you would most likely have torn right through here. This is the most common area. You can also tear higher up, closer around the urethra, but most people will kind of recognize the tearing here. Maybe you've had stitches to repair that, and there are varying degrees of that tearing and how deep it goes and how close to the anal sphincter it gets. So it's graded basically with how far down it goes, but it can go very deep as well. That just is variable, and you don't really know. So that's one cause for pain. I'm gonna kind of circle back. But then these deep pelvic floor muscles, this would be layer 3. The second layer is kind of in between, and you can't really see it much. But this layer kind of does the bulk of the work. When you think of doing Kegels, this is what muscle is really working with that. And this can be really problematic as well. It is pretty common that you get issues where the muscles are overactive, or if you can think of it kind of as being too tight. It's almost like when we're really stressed out and we tend to hold our tension here, the muscles just can't relax very well. And the same can happen on the pelvic floor. Those muscles can kind of tighten up and they just stay contracted, and then that can lead to pain issues. So probably one of the most frequent issues that we see here in our clinic is painful intercourse. Now, pain can be a lot of different things. It could be sharp stabbing, it could be burning, it could be adult achy pain, it can be, really deep, it can be superficial. There's a really wide assortment. None of that's normal. It shouldn't be pain. So sex should never be painful, regardless of if it's after a surgery, if it's after childbirth, if it's maybe later on in life and you're in menopause. All of these stages, if you will, have women kind of dealing with these problems, but it's not normal at any point. So to kind of dive in, because I think pain is probably one of the biggest issues, I did mention that tearing or with that episiotomy, any kind of trauma to this, you're going to have scar tissue. So if you've had tearing, if you've had an episiotomy, or even any kind of surgery, your body produces scar tissue as its natural way of healing, and that scar tissue can be very painful. So if you have scar tissue here, oftentimes you'll have pain more at the opening or more superficial. Your pain might be more so with penetration as well. And it might be really sharp stabbing pain. It might be more of a burning pain. Those are kind of different ways of describing that. So that's the first really common reason for pain. And then when I talked about that overactive muscle, that's another big cause of pain, because when that muscle is really tight, it can give you this pain. You can also have trigger points in those muscles too. And so when you put pressure on it, it'll give pain. So a lot of times women might experience this more as like a dull achy pain, or more so just like a soreness. Other times it might be sharp stabbing, but it will feel kind of deeper inside if it's these pelvic floor muscles. So you can kind of think about really where your pain is will kind of give you a little bit more guidance as to what the culprit is. So that's a big factor with pain. Now, we also see women, and sometimes this goes hand in hand, they have issues with dryness or even issues with orgasm. So maybe it's difficult to achieve it, or it's not as strong, or maybe you're having pain with orgasm. So to touch on some of that, the dryness issues that women experience are primarily hormonally driven. If you have decreased estrogen, then your tissue just does not secrete as much of that mucus that creates that lubrication. And so this is common kind of immediately after childbirth, especially if you're nursing, your estrogen levels are going to be low. It also starts to happen as hormones start to fluctuate as we get older and we're in perimenopause and then beyond menopause into that post-menopause phase. And so dryness can also contribute to pain, but one thing you can do if you're looking for more natural ways of addressing this, some physicians will prescribe an estrogen cream here, which can definitely help. But if you want something more natural, we also try to do anything that's going to bring more blood flow into the area. So more blood flow will help you create more of that lubrication. And so one way to do that is with vibration. And that's something that we teach our clients. We use certain devices that can introduce vibration to that area and increase that blood flow. So that's one option. That increased blood flow is also going to help with any kind of issues with orgasm. So if we have poor blood flow to this area, orgasm is going to be really difficult, or it's not going to be as strong. And so any kind of restrictions through these superficial muscles can give you that problem. Basically, you have that clitoral hood is kind of attached with the muscle, and sometimes it gets stuck or it's restricted and you can't get stimulation to the right area. And then you also, when these muscles are tight, it's going to restrict that blood flow. So we do a lot of hands-on techniques here to really help release that. You also have a lot of these nerves that come kind of from the sit bones out and across. And that innervates everything, especially the clitoris. And so if things are tight here, it's also going to compress on the nerve. So not only is it impacting blood flow, but also the nerve supply. So the best thing we can do for that is releasing any restrictions and then increasing blood flow. And that's kind of a common theme for a lot of these issues. So with any issues with orgasm, we really want to look at the superficial muscles. How are they moving? Are they too tight? Do we need to loosen them up? And do we need to bring more blood flow and nerve supply into the area? If you're having dryness issues, again, bringing in blood flow can help. Sometimes it's a vicious cycle. If you're having pain, you're going to have more issues with dryness because your body's anticipating that pain and it's not going to produce as much of that mucus that you need. So it's a little bit of a double-edged sword with that, but helping increase blood flow using vibration, any kind of manual physical therapy technique that we do will also increase blood flow there. So sometimes working on one area addresses another, if that makes sense. And then with pain, we want to, again, restore the proper mobility of the muscles. So if you have scar tissue or tearing, we really want to break that up, get rid of that scar tissue, kind of realign all that connective tissue and make sure that everything can move properly. And then if these deeper muscles are an issue, we want to kind of release them so they're not so tight. We want to release so that they're not painful and they can actually function properly. So I hope this helps visualize why some of these issues are happening and what you can do. But I would really, really strongly encourage you, if you're having any issues, especially pain, please seek out help. These issues don't just get better with more time, which is what a lot of people think. You know, give it more time, things are still healing, or it'll just get better if, you know, I just keep working at it. Don't keep suffering. Seek out help. Find a pelvic floor physical therapist, because we can get to that root cause and address things and fix them. And this is oftentimes stuff that you can't do yourself at home. So if you're kind of ready to take that next step and you want to stop suffering, check out the link. We do offer a free sex assessment where we give you a personalized sex blueprint, where we kind of go through what your root issues are, and what you would need to kind of fix that, whether it's certain lubricants, certain tools, or even certain physical therapy techniques or exercises. So check that out if you're interested.